Dr. Shannon Clark here. I am currently listening to the Something Was Wrong podcast, season 23, about the Origins Birth and Wellness Center up in Dallas and what happened. In episode 1, they're talking to Kristen, a former patient of that birth center. And I want to touch on something that she discusses regarding her prenatal care. Now, Kristen was a 22-year-old, first pregnancy, 118 pounds, otherwise healthy. And she was a patient at this birth center. Now, she says that at some point in her second trimester of pregnancy, which second trimester is about 14 weeks to 28 weeks of pregnancy, she started having signs and symptoms of preeclampsia. She says that she was seeing spots and she had some elevated blood pressures when she would go for her prenatal visits. Now, she talks about how they were taking her blood pressure with the wrist cuff. That's what I want to talk about. Measuring blood pressure in routine prenatal visits is crucial because that's how we actually pick up a lot of cases of chronic hypertension or preeclampsia in pregnancy, because the patients don't necessarily come in knowing they have high blood pressure, and we pick it up on a routine prenatal visit when we're doing their blood pressure. And we don't use a wrist cuff to get that blood pressure. There is a proper way to get blood pressure measurements in pregnancy. Now, this is from the ACOG practice bulletin on chronic hypertension in pregnancy. And this is how you are supposed to get a blood pressure reading in pregnancy. And you want to use an appropriate size arm cuff, not wrist. And here are what the guidelines are for us to ensure that we're using the appropriate size cuff when getting those blood pressure readings at prenatal visits. Pause to read. If you get a cuff that is either too big or too small, that can falsely elevate or lower your blood pressure reading. And even though when patients are asked to take their blood pressures at home, they do wrist cuffs at home a lot, the ideal way is still to do your blood pressure through a cuff measurement. So the fact that a center providing prenatal care was using a wrist monitor for blood pressure, red flag. Now, Kristen also said that when she asked her provider why her blood pressure was going up in pregnancy, she was told it was normal because blood volume is doubling in pregnancy, which your blood volume does physiologically increase in pregnancy for a number of reasons. But that's not what happens with your blood pressure. You enter a pregnancy with your pre-pregnancy blood pressure values. Then in the second half of the pregnancy, your second trimester, they dip or have a nadir of 5 to 10 millimeters of mercury in that top and bottom number. Then in the third trimester, they start to go back up to pre-pregnancy values. So the fact that a provider was telling her that her high blood pressure in the second trimester was normal is a huge red flag, because that is not how the physiology of pregnancy works.